Hi, my name is Tamara White from Kaiser University. This is a biosocial review of cardiac issues. First, we will introduce the presentation, discuss the pathosociology of disease, management of behavioral and psychosocial factors, and then summarize the presentation. We will discuss the pathopsychology of disease, including vulnerable plaque, coronary heart disease, risk predictions, psychosocial factors and events, also the management and behavioral of psychosocial factors, including implementing behavioral lifestyle interventions, smoking cessation, and dietary, also exercise and psychosocial interventions. And then we will summarize the presentation. The pathopsychology of disease. Arteriosclerosis is prevalent in cardiovascular disease. It includes inflammation, plaque buildup, vulnerable plaque, and abnormal wall thickness. Coronary heart disease risk predictions includes age, hypertension, cholesterol, cigarette smoking, diabetes, plaque formation, again, abnormal wall thickness, sex. Although cardiac heart disease is more prevalent in men, it is the leading cause of death for women. Also stress and hostility, which leads to hypertension. Psychosocial factors and cardiac heart disease events include depression, hostility and anger, unhealthy lifestyle, sleep disruption, anxiety, social isolation. Social isolation is more prevalent for women, and psychosocial work characteristics, which include high job demand, low decision latitudes, and job strain. Management of behavioral and psychosocial factors. Implementing behavioral and lifestyle interventions includes education and knowledge, motivation, which are both important for lifestyle changes, smoking cessation. Treatment options include nicotine replacement, group or individual counseling, and self-help, and that includes providing the patient with educational materials. Techniques for implementing change include identifying treatment goals and timelines, assigning small manageable tasks that can be monitored, contracts between the patient and the care provider to reach self-care goals, evaluating the patient's readiness for change. Enlisting social support is very important, and encouraging and teaching self-motivating or self-monitoring behavior. And of course, follow-up. Also, with implementing lifestyle interventions, diet, which include low-fat diets, fruits and vegetables, whole grains, beans and nuts, fish oil or fish, fish that is high in omega-3 fatty acids. Some fish you really have to be careful of because there has been toxicity issues, but it is safe to say for the most part, if high quality salmon is good. And there are several models for the Mediterranean diet as a very healthy diet. Exercise is very important, including aerobic activity exercise, which also includes walking, jogging, and bicycling. But it is very important that exercise activities are monitored by the care provider and the patient is released or okay to do exercise, healthy exercise. Aerobic exercise is recommended at least 2 times a week. Great rehabilitation are cardiac care centers that have their own rehabilitation facilities. Psychosocial interventions with anxiety, again, anger and hostility and depression. A lot of these you can tell are all intertwined. Improving quality of life will also help improve a lot of the psychosocial behaviors. Social isolation includes loneliness, physical inactivity, smoking, low self-esteem, lack of coping skills, and again, depression. So here we have discussed the pathopsychology of disease, including arteriosclerosis, coronary heart disease risk predictions, psychosocial factors, management of behavioral and psychosocial factors, including implementing behavioral interventions, techniques for implementing change, and implementing behavioral lifestyle interventions. Thank you for your time.